In February 2019, Choice went to the United Nations headquarters in Geneva to participate in the Office of the High Commissioner on Human Rights' consultation on human rights and HIV response. We were there to advocate for integrated, youth-friendly sexual and reproductive health and HIV health services, as well as to ensure a youth lens was addressed in the consultation. The consultation lasted for 2 days, with panel discussions on human rights and the HIV response and the challenges and opportunities we see there, how we can uphold the right to health through regional mechanisms and strategies, as well as how we can deliver on the Leave No One Behind promise and address stigma, discrimination, violence, and abuse. During this panel, Choice made a statement championing meaningful youth participation in HIV response on behalf of 12 youth-led organizations, because we believe that it is possible to end HIV epidemic among young people by 2030, despite the increasing number of young people affected by HIV globally. But to do so, it is essential that member states and UN agencies ensure the meaningful participation of young people in the design, implementation, and evaluation of HIV policies, so that these policies actually meet the needs of young people. Equally important is that states review and repeal punitive and discriminatory laws, including laws criminalizing consensual sexual behavior of young key populations, age of consent laws, and laws prohibiting legal gender recognition. There is also a need to strengthen the youth-friendly capacity of health workers and to ensure that young people have access to integrated, youth-friendly sexual and reproductive health and HIV health services, as well as comprehensive information on these matters. In practice, this means that services will be made easily accessible, and that when young people go to access reproductive health services, for instance, they can simultaneously access HIV services without fear of stigma or discrimination from the health worker. The Office of the High Commissioner on Human Rights is going to draft an outcome report about this consultation. This report will be presented to the Human Rights Council during its 31st session in June 2019. While the report won't be a binding one, it will be a valuable document to use in our advocacy efforts to keep member states and UN agencies accountable when it comes to human rights and HIV response. We therefore hope that this report will acknowledge meaningful youth participation as a best practice in HIV response.